Hi there, Dr. Ibe Nathans once again. Hope you are all doing well. I had a long chat with a friend yesterday. One of my friends called me, and I felt I share the talk with us in this platform. He said that recently, in the last 4 to 6 weeks, he wakes up 3 4 times at night to pass urine. And then I asked him about his water, fluid, coffee, and tea intake, which he said were normal. Because if you're indulging in high fluid, water, tea, coffee intake, most importantly, before going to bed, that can make you pass really more at night. But he said they were normal. So I was concerned and I advised him on what to do. Basically, if you're a black person, Afro Caribbean, above the age of 40, and you find yourself passing urine more at night, what we call nocturia, passing urine 3 4 5 times at night, that could be concerning because this can be one of the symptoms suggestive of what we call BPH, which is benign prostatic hyperplasia, and BPH, called known as benign prostatic hyperplasia. Basically, it is the prostate being enlarged. Yes, passing urine more at night could be one of the symptoms. There are other symptoms, which means you have a poor flow of urine, a poor stream. Sometimes you feel full, you want to go. When you go there, you just have trickles of urine. It doesn't come out much. Sometimes you can't hold your urine for a long period of time, and you can't control your bladder. You can equally have dribbling after passing urine. These are some of the symptoms suggestive of BPH, benign prostatic hyperplasia, enlarged prostate being bigger than usual. And there are tests that needs to be done. First of all, you have to be sent for a blood test to check for PSA, prostate specific antigen. It's a blood test. We also do your urine test as well to check for prostate infection or inflammation called prostatitis. And based on the findings, your doctor may have to send you for MRI scan of the prostate, ultrasound scan. If the Depending on how high, how raised the PSA is, you can be diagnosed with BPH or prostate cancer. Prostate cancer, BPH, is much more common in black people. It's more common in black people than the white. In fact, in my clinic, I screen all my patients from the age of 40, 45. I ask them specific questions on their urine, how many times they pass urine at night, if they can hold their urine, and yes, I do check them thoroughly for. I do send them for PSA. Sometimes you can even find the BPH by incidental findings. Yeah. So, however, regardless of the BPH, the prostate cancer, if you're male, female, and you find yourself passing urine more than usual, you've checked yourself, you don't drink a lot of coffee, a lot of tea, fizzy drinks, water, you are passing urine more than usual, you have to, in any case, see your healthcare provider, your doctor, for further investigations. You have to be checked for diabetes. One of the signs of diabetes is what we call polyuria, passing urine a lot more than usual, polydipsia, drinking a lot. Check for UTI, urinary tract infection, what they call cystitis in some cases. Checking for prostate infection, prostatitis, and other causes as well. You need to be sent for bloods, your urine sent for culture and sensitivity, and for other checks to make sure these are covered. You don't trivialize that. It could be It could be something serious, but if you are not investigated, you will never know. Obviously, diabetes, BPH, enlarged prostate cancer, UTIs, they are very vast topics which we really can't cover in this short talk. Yes, my friend says, and he will see his doctor today for the investigations. So, yeah, take care of yourselves, your loved ones, your family members. Be safe and play safe. Be good. God bless. Bye.